I have my oldest one, Levi, is just graduated from Thompson Rivers University as an RN and just beginning his career. And I have another son, Aaron, who's 13 months younger, and he was a student. And we lost him this year, April 26, 2021, at the age of 26, almost 27. Aaron did well in school, had a great group of friends. Unfortunately, Aaron struggled with substance use. It started with alcohol, and most of us didn't see any red flags.
A lot of these deaths are being called deaths of despair, and they're really happening in areas where unemployment is high, and people are, don't have anything to do. They may be injured from jobs. We've seen very high rates in construction workers, people in the trades.
He went north to work, and that's when I think it really started to take hold of him.
They use these drugs often just to help with the injuries they've had during their work, but then they'll get cut off by their doctor, whatever, and they're on the street looking for these medications and end up getting a poison supply and die. We've seen this cut through the whole swath of Canadian society, and there are, certainly the younger people are being hit hardest, but there's no limit to who this can affect.
When he came home, he always felt safe and secure, and it was a way to reset. Not that we really knew that. He wasn't suicidal in any way and had never shown any signs of that.
And for many people, it can just be one bit of happiness in their lives when they're miserable from everything else. So they're so desperate that they're looking for some stimulation.
If your child is struggling in school, your relationship to them trumps that assignment. When it comes to substance use challenges, you wanting them to stop, most people put that as number one. I need you to stop. We need you to stop, being the community. But we need to take that out and say, I need you to know I love you. I need you to know we all support you. And don't use the word but after that. That but will kill what you just said. So I had to learn that only because there were times where I really was thinking I was facing the reality that he may be gone. And so when he'd answer my text and say, I'm okay, Mom, I'll see you later, I was always so thankful of that. And I would be saying to myself, you really don't know how much longer you have with this kid. Something could happen to him. And so do you want to be fighting with him about his addictions? Or do you want to remember that you had a really good discussion with him over coffee, or that he knew that you loved him? And that I chose that.
The biggest problem we have right now is the contaminated drug supply. If we had a safe supply, people would be able to use drugs in a more safe manner, and the overdose rate would drop substantially. We would still have people using opiates at that stage, but a couple things would happen. First off, they're not going to die. Secondly, part of the issue around drug use is that many people who use drugs also sell drugs. So if you give people the drugs they need, then they have no reason to sell drugs, and they have less reason to go out and steal, involved in sex work, anything like that. So you improve their lives tremendously by doing that. And in Switzerland, where they do this regularly, they give safe supply to people, they have far fewer heroin users because those heroin users have no motivation to help get others on heroin. It's for sure, safe supply is only the start, but it's the start by saving people's lives and then working from there to deal with what's going on.
Before I listened to the experts, I was more just kind of doing what I thought and felt I should do, and it really ran on my own opinion. I know that my grief would look way different because I know there's a chance that I would have kicked him out and he would have been on his own. I would have severed that relationship. And all the psychological problems I would have got from all of that.
You know, at one point I thought that naloxone would be the answer, and if we got enough naloxone out there, well, there would be no problem. But the deaths have continued to skyrocket, and that, you know, we're seeing far more deaths in British Columbia than we are from COVID. But while our government is moving somewhat aggressively, somewhat actively on COVID, we're really seeing very little movement on safe supply. And that's really the only thing that's going to get us out of this right now. And it's super unpopular politically. You know, you can imagine how people feel when we say, well, we're going to give free drugs to drug addicts, to IV drug users. And they're like, well, I don't get my drugs for free. And I don't get my insulin for free. Where are these guys getting them? And, you know, that's kind of a legitimate point, but it's really about healthcare. It's really about trying to keep people alive.